Hello everyone, Professor Bay here. Welcome to our lesson on infection. In this lecture, we're going to talk about how microorganisms cause disease, how infections spread throughout the body, and the body's response to the invading pathogen. Because remember, we do want to focus on cellular response, how these pathogens affect the body at a cellular level and how the body responds. Understanding infection is essential, especially for healthcare professionals. So if you are going to be a nurse, this is a very important topic for you because they affect every body system and remain a major cause of illness throughout the world. As we move through this lesson, please think about how the concepts connect to patient care, infection prevention, and treatment decisions. Not all microorganisms are the same. There are different types of microbes, which have different structures, methods of reproduction, and how we treat them. Bacteria are single-celled organisms that can survive independently without a host. They may be classified by shape, such as cocci or bacilli, and by cell wall structure, such as gram-positive or gram-negative. Viruses are much smaller and require a host cell to reproduce. They essentially just hijack the host cell's machinery and create more viruses. Because remember, viruses, they want to spread. Fungi are eukaryotic, organisms, meaning they are more complex than bacteria. While while many of them are harmless, some can cause infections such as thrush, athlete's foot. Other infections, like infectious agents like protozoa, parasitic worms called helminths and prions, which are abnormal proteins, can cause serious neurological diseases. Understanding the type of organism involved helps guide treatment decisions because antibiotics work on bacteria, but not on viruses. This chart here compares the several major classes of pathogens. Notice the differences in the cellular structure, reproduction, and treatment approaches. Bacteria basically reproduce through binary fission and are typically treated with antibacterial medications, or maybe antimicrobials like penicillins, for example. Viruses reproduce by invading host cells and require antiviral therapy. Antibiotics will not work for viruses, for example, the common cold. Fungi reproduce through budding or spores and are treated with antifungal medications. These differences are really important because successful treatment depends on identifying the correct pathogen. Giving antibiotics, for example, for viral infection will not be effective. And most importantly, look at the primary countermeasures. We use antibacterials for bacteria, antivirals for viruses. They are not interchangeable. This diagram here shows the structure of the bacterial cell. The cell wall helps determine bacterial shape and plays a major role in gram staining. Some bacteria possess capsules or slime layers that help protect them from host immune systems. Because remember, they want to survive and they want to spread. That's what they do, right? Pili and fimbriae allow bacteria to attach to tissues and can facilitate genetic exchange. Notice the toxins section. Exotoxins are secreted toxins that directly damage the tissues, while endotoxins are released when bacteria die and break apart. So some bacteria can also form endospores, which are highly resistant structures that allow survival under harsh conditions. This is one reason certain infections can be very difficult to eliminate. Because viruses can't reproduce on their own, they're ultimate hijackers. The sequence, because remember, if they can reproduce on their own, they don't need stuff, a lot from the host, right? But because they can't, reproduce on their own, they want to use everything they can from the host. So the sequence starts with attachment, penetration, followed by uncoating to release their genetic material. Once inside, they take over the cell's command center, forcing it to synthesize and assemble new viral components. This ends with lysis, where the host cell ruptures and releases a fresh army of viruses to infect other adjacent cells. So it's basically, that's why this, it's called a viral hijack. Now, not all microorganisms are harmful, right? We have our resident flora, also called our normal flora, or microbiota, or microbia. Naturally, they live within our bodies. So these organisms often provide benefits and help prevent colonization by harmful microbes. So these are the good bacteria. Now, problems occur when these organisms move to locations where they don't belong, or when the immune system becomes compromised, like in the previous lecture when we talked about immunity. So if the immune system is compromised, then these can become a problem. Now, this can lead to opportunistic infections. A classic example is normal intestinal bacteria entering the urinary tract, and that can lead to a urinary tract infection because it does not belong in the urinary tract. It belongs in your intestines. Pathogenicity refers to a microorganism's ability to cause disease. Virulence, on the other hand, refers to the degree of damage that the organism causes. So they're two different things. A highly virulent organism is very effective at invading tissues because remember in the past slide, we talked about how they hijack, right, the host. And then they produce toxins, attach to cells, and evade immune defenses. Many microorganisms mutate frequently, allowing them to avoid recognition by the immune system. So this ability actually contributes to their virulence and makes some infections particularly difficult to control. Now, for an infection to occur, three key elements must be present: a reservoir, a mode of transmission, and a susceptible host. So the reservoir is where the organism lives and multiplies. The mode of transmission describes how it spreads. And the susceptible host is the person whose immune defenses are inadequate to prevent infection. Notice the different transmission routes: direct contact, indirect contact, the fomites, respiratory droplets, and vector-borne transmission. Now, breaking this link in the chain can prevent infection. This is why hand hygiene is one of the most effective infection control measures. And you see these signs in the hospitals. So those of you who work in the hospital environment or will be working in the hospital environment, you'll see signs posted on the room specifically for the type of, the mode of transmission that pathogen takes. So think of infection as a balancing act, basically. One side, we have the microbial influence, factors like toxins and protective slime layers. On the other side, we have the host resistance, which includes our physical barriers, like the skin, the cilia, the saliva, all those things. Then the chemical defenses, like stomach acid, right? Huge defense. And our systemic immune system response. So infection only manifests when virulence severely outweighs resistance. This can be triggered by age, stress, immunodeficiency. So as long as, our host resistance is strong, then the microbes cannot hijack our body. Every infection follows a timeline. It starts with the incubation period where the pathogen count is slowly rising, but there are no clinical signs. This moves into the prodromal period. Those vague, okay, I'm coming down with something kind of symptoms. So this is the most contagious stage because we're not exactly sure what it is, and so we spread it more easily because then we expose other people to it. Now, the acute period is where the infection is fully established and manifestations start to peak. If the infection is overwhelming, and remember the host resistance is low, and so in that case, it can lead to septicemia or even death. Now, infections can be classified in several ways. A local infection remains confined to one area, right? For example, like a surgical incision infection is infected in that surgical site. A focal infection begins locally and spreads to the nearby tissues. A systemic infection affects multiple body systems. You may also hear terms such as bacteremia, viremia, toxemia, septicemia, which all of these describe microorganisms or toxins circulating in the blood. So once they get in the blood, remember the blood circulates everywhere. And so that will just circulate to every part of the body. So infections could be acute, chronic, primary, secondary, or subclinical, depending on their duration and their presentation. As future clinicians, for those of you in nursing school, you'll look for both local and systemic signs. Local signs will include your cardinal signs, right? The redness, the erythema, the warmth, swelling, purulent exudate, for example, if it's a wound infection. Systemic signs affect the entire body. So you're going to see systemic signs, for example, fever, pyrexia, an elevated white blood cell count, which is called leukocytosis, fatigue, general fatigue, and in severe cases, neurological signs like confusion or seizures. Well, you'll also see that, especially in the geriatric population, when they get a UTI, you will see those systemic signs of confusion. So how do we know what we're fighting? It's really important to know, right? Before you treat something, you need to know what you're fighting, right? So we use culture and identification to grow specimens and observe their morphology, staining techniques like gram staining. These help us determine the cell wall structure, which is crucial for choosing the right antibiotic because you have to choose the right antibiotic to kill that bacteria, and and the cell wall structure helps a lot for doctors to determine which antibiotic to use. Finally, we also use sensitivity testing, right? This to find like the zones of inhibition where bacteria cannot grow to ensure effective drug therapy. So once the infection is identified, treatment depends on the type of microorganism causing the disease. So antimicrobial drugs are basically classified based on their mechanism of action, the way they work, and the type of microbe that they're targeting, right? What kind of bacteria they're targeting, how is it formed? They need to know that. That's how they're classified. So for bacterial infections, we use antibiotics. Now, some antibiotics are bactericidal. What does that mean? So if you think of the word cidal, homicidal, suicidal, kill, right? That's what it means. So they directly kill the bacteria, while others are bacteriostatic. So if you think of the word static, what does that mean? Slowing down, right? And so bacteriostatic means that they stop the bacteria from reproducing and they allow the body's immune system to catch up and eliminate the infection. For example, in the geriatric population, or if you have a patient, a weak host, like a patient with cancer, right? These people in those kind of hosts, their immune system isn't very strong, right? They're immunocompromised. And so when somebody is immunocompromised, the body takes longer to eliminate the infection. So bacteriostatic antibiotics will slow down the bacteria to give them the opportunity to kill the bacteria. So now another thing to kill the bacteria, we target structures and processes that are unique to the bacterial cells. Think of antibiotics like as a specialized weapon designed to exploit bacterial weaknesses, right? It, it sees the weakness in the bacteria and it knows exactly how to target it. Now, some drugs, for example, penicillin, attack the bacterial cell wall. That's why you have to look at the mechanism of action when you read about antibiotics, the different kinds. Look at their mechanism of actions, right? So penicillins basically attack the cell wall, the cell wall of the bacteria. This is very effective because human cells do not have cell walls, right? And so this allows the medication to target the bacteria without damaging most of the human tissues. Now, other antibiotics interfere with protein synthesis, or which disrupt the cell membrane, interfere with nucleic acid synthesis, or block important metabolic processes needed for bacterial survival. So for example, if a bacteria attaches to a protein to be able to penetrate through the cell membrane, so the medication will basically interfere with protein synthesis. And so now the bacteria cannot attach to that protein to transport through the cell membrane. So it's amazing how, different antibiotics work differently. So when you're reading, you're studying for your pharmacology and you're looking at antimicrobials, look at their mechanism of action. You can learn a lot about the, antibiotics for that. So antibiotics, they're also classified as broad spectrum and narrow spectrum. Broad spectrum antibiotics, basically they're effective against a wide variety of bacteria, now including both gram-positive and gram-negative. Now this, even though this is helpful, and when you don't know the exact organism, then they basically disrupt the body's normal resident flora too. And remember, we said those are good bacteria, right? We don't want that to go away. We don't want that destroyed. And it just makes us weaker, right? So when you use a lot of broad spectrum antibiotics, they kill a lot of our normal flora, our resident flora. And this is why a lot of people end up, getting C. diff for certain infections, because now they don't have their normal flora to protect them against the bad bacteria. Narrow spectrum antibiotics target specific bacteria, and these are generally less likely to disturb beneficial microorganisms, our normal flora. Antifungal medications, they're used to treat fungal infections. And one challenge with antifungal therapy is that fungi are eukaryotic cells. Because of these, meaning that their cells are structurally similar to human cells. Now, because of these similarities, antifungal drugs may have a higher risk of toxicity and side effects compared with many antibacterial medications. The key point to remember, honestly, is that effective treatment depends on correctly identifying the type of microorganisms, because each group of microbes has a unique structure and vulnerabilities that require different therapeutic approaches. Now, for viral infections, antiviral drugs are used. Unlike antibiotics, antivirals do not kill viruses, right? They don't, like the common cold, right? You're not going to kill the cold, right? You're going to, or like the flu. So instead, they reduce the viral replication. So what they do is they basically reduce how fast it replicates and spreads, right? So within the body. And this gives the immune system a better chance to control the infection. So it slows it down, right? Almost like a bacteriostatic antibiotic. Now, for example, zidovudine, AZT medication, inhibits the conversion of RNA to DNA in HIV treatment. Now, because viruses live inside our cells, these drugs often have significant side effects on the host. Now we're going to move on to the second half of our lecture, which is just, specific infectious diseases. We're going to look at pathogens that most commonly challenge our healthcare system. Now, pathogens travel in different ways, right? We have respiratory invaders like influenza, RSV, that spreads through airborne droplets. Remember, we talked about the mode of transmissions. We have healthcare battlegrounds where resistant bacteria like MRSA thrive, right? So there are zoonotic threats from animal reservoirs like Lyme and rabies, and environmental ingestion from contaminated food or water like salmonellosis or salmonella. Let's look at the structure of the flu virus. It's an RNA virus with a lipid envelope. Okay, it's enveloped inside, the envelope around it is a lipid. Now, crucially, its surface is covered in hemagglutinin. And now you don't need to know all these details, but it's interesting to read about these to see how they work, right? And so basically the surface is covered in hemagglutinin and neuraminidase proteins. These are proteins. These proteins, and they mutate so frequently that we have to update the flu vaccine every single year because of this constant mutation. So every year it's a different, we say a strand. So influenza is a viral respiratory infection caused by single-stranded RNA viruses. It spreads through respiratory droplets, aerosols, and body fluids. Common symptoms, we have fever, chills, muscle aches, sore throat, congestion, fatigue. One challenge with influenza is its ability to mutate frequently, right? As we mentioned, which is why flu vaccines are updated very regularly. Severe influenza can also lead to complications such as pneumonia if it's not treated, or if it's not slowed down, or if the host is weak. The MMR diseases were once common childhood illnesses, like for example measles, typically presents with fever, cough, and a characteristic rash. We call it the measles rash. right? So mumps often cause swelling of the salivary glands. Rubella generally causes a mild rash and fever, but can be devastating during pregnancy because of its association with birth defects. Now, vaccinations have dramatically reduced the incidence of these diseases. So this is important for us to educate our patients about. Now, some viruses never completely leave the body after the initial infection. So instead, they enter a dormant stage, or we call it the latent state, and they remain inactive for years, right? This group of viruses often referred to as the latency family, and this includes the herpes simplex, HSV types 1 and 2, as well as varicella zoster virus, the VZV. HSV is most commonly caused by oral herpes or cold sores, while HSV2, type 2, is more commonly associated with genital herpes. The varicella zoster virus causes chickenpox during the initial infection, normally during childhood, but can reactivate later once the patient has, chickenpox as a kid. It can reactivate later in life as shingles. This happens when they're in stress or when, for example, when they get an infection and their body's under stress and it kind of reactivates as shingles, which is a very painful thing, for people. Now, although symptoms would disappear, these viruses remain hidden within the body and reactivate during periods of stress, illness, aging, immunosuppression, leading to recurrent outbreaks. So you'll find patients who have had chickenpox in their older age when they're under stress or they have an infection. They basically get recurrent outbreaks of shingles every time they're stressed. Now, mononucleosis is caused by the Epstein-Barr virus, EBV, and it's often called the kissing disease because it spreads through the saliva. It's very common in teenagers, and it causes high fever, sore throat, significantly swollen lymph glands. Because remember, in our lymphatic lecture, we talked about why we feel those lymph glands, those swollen lymph glands, because remember, this is where they are trying to kill that bacteria, right, or virus. And so you feel the swelling over there. Now, while it usually is self-limiting, the resulting fatigue can be extremely intense. RSV is it's a very highly contagious and spreads through droplets. It can even live on surfaces for a while as well. It's a leading cause of bronchitis, especially in children, because, with children, they're not really careful about containing, their sneezing or their coughing, and then they touch everything. And so it's easily spread amongst children. It's very common among them. For those of you who are in nursing school and want to go into pediatrics, you'll see this very commonly in peds. So while it usually resolves in a week or two, it can cause severe respiratory distress, especially in infants. MRSA and the methicillin-resistant Staphylococcus aureus. MRSA is a type of bacteria that has developed resistance to many commonly used antibiotics, which makes the infections difficult to treat. Because remember, we said that different antibiotics use different mechanism of actions to kill different type of bacteria. So MRSA has become really resistant. So even, different kinds of antibiotics wouldn't work on it. So it's considered a superbug, and it's one of the most common antibiotic resistant pathogens encountered in healthcare settings. Now, in fact, MRSA accounts for approximately 80% of the Staphylococcus aureus infections that we see, right? And one of the major, honestly, cause of this, if you think of, you think of the penicillin endemic in the past with broad spectrum antibiotics were just given widespread, given to anybody for anything, even for the common cold, people would ask for a penicillin, right? And so with these broad spectrum antibiotics becoming so common, that their bodies start becoming resistant, so the bacteria get smarter and smarter and smarter, right? And so that's how they become extremely resistant to a lot of different kind of medications, and they become superbugs. So this can be acquired in hospitals, long-term care facilities, or even in the community. Now, these infections can range from relatively minor skin infections like MRSA in the skin on a wound, such as painful boils or abscesses, to severe systemic infections that affect multiple organs, and can cause systemic symptoms like fever, confusion, breathing difficulties, sepsis, because remember, they're affecting, just spreading, circulating in the blood and spreading everywhere. Another important antibiotic resistant organism that you hear about is VRE, right? Vancomycin resistant enterococcus, and these are bacteria that normally live in the GI tract and are usually harmless, right? However, in hospitalized patients or immunocompromised patients, as we mentioned even with previously, they can cause serious infections of the urinary tract, bloodstream, surgical wounds, or even heart valves. People who have heart valves, they can get infected from VRE. VRE has developed resistance to vancomycin, an antibiotic often reserved for severe infections, which makes treatment options even more limited because normally when a patient has MRSA, they're given vancomycin because vancomycin is so strong that it can treat it because the other antibiotics their mechanism of action doesn't work on MRSA, and so they're given vancomycin. But now if they become vancomycin resistant, then they technically have hardly any antibiotics that can treat their infection, right? So both MRSA and VRE are particularly concerning because they can spread easily in healthcare environments through contaminated hands, equipment, surfaces. Patients with weakened immune systems, for example, patients with cancer, that, or invasive devices such as urinary catheters or central lines and prolonged hospital stays. All of these situations, people are at increased risk. Now, one reason MRSA is so difficult to treat that it has because it's evolved mechanisms that prevent, like I mentioned, and antibiotics, many of the antibiotics from working effectively. So what it does, it basically produces altered proteins as the antibiotic target sites, making it difficult for certain drugs to bind and destroy the bacteria. Because remember, some drugs, antimicrobials, they, slow down protein synthesis or stop protein synthesis. So what the MRSA bug does is that it alters that protein. So it's super smart, and like VRE too, it has developed genetic changes that allow it to survive despite treatment with vancomycin. This just goes to show how important hand hygiene and hygiene in general is, and like line infections in the hospital, making sure we're using sterile procedures for like catheters, urinary catheters, making sure they're not there unnecessarily in patients. So these are all infection control measures we see in hospitals. Now here's some more information on MRSA and how it affects the body. Please review this slide. Now let's talk about C. diff, very popular in the hospitals. Now C. diff is gram-positive, spore-forming bacterium, and it's a major cause of healthcare-associated diarrhea. So it often takes hold after antibiotics have wiped out a patient's normal intestinal flora, because remember we mentioned, that broad-spectrum antibiotics just kill any bacteria, good and bad. So now when people lose their normal flora because of widespread use of, broad spectrum antibiotics, they end up developing C. diff. Now, because the spores are highly resistant, and these spores that are spread from C. diff are highly resistant, so hand hygiene with soap and water is used. We cannot use alcohol because those spores are highly resistant. And so in order to prevent it, we wash with C. diff spores, we wash with water and soap. Finally, we have threats from what we eat and touch. For example, the salmonellosis is a bacteria, and it comes from contaminated food or feces. Like, for example, if we eat a lot of like fast food, that's why they tell fast food workers to wash your hands after using the bathroom, because the feces that's underneath their fingernails, I know it sounds gross, next time you eat, you know, fast or burger or something from a fast food joint, you're going to remember the feces under the fingernails, right? And so then if the workers, they don't wash their hands and then they touch the food, it kind of transmits over. So a lot of, research has shown that, like, they even did the study where they checked the ice at different fast food joints and they found fecal matter in the ice, right? I know it's gross. Sorry. But toxoplasmosis is a parasitic threat that is particularly dangerous for pregnant women because it can cause serious complications for the fetus. Now, our last slide covers the zoonotic threats. Lyme disease it spreads via tick bites and causes flu-like signs and limb weakness, right? Rabies is transmitted through animal saliva. So it allows it follows a terrifying progression from fever to muscle spasms and paralysis. And so once neurological symptoms appear, it's almost always fatal. And so it's really important. I mean, as much as we love our pets, their saliva contains, bacteria that, our body cannot handle, right? It's not our normal flora. And so, as much as we love them, we still have to practice hygiene. Okay, and that is it for our lecture on infection. Just understanding how organisms cause disease, how infections spread, and how antimicrobial therapies work provides a foundation for recognizing and preventing infection in clinical practice. As healthcare workers, future nurses, if you're in nursing school, one of our most powerful tools remains infection prevention, especially through hand hygiene, vaccination, and evidence-based infection control practices. And that is it.